Please welcome to the stage, founder and CEO of Guardian Alpha, Chuck Schneider.
If you had one shot, one opportunity.
A friend of mine, Chad, a few weeks ago on February 11th, wasn't feeling well. It was the second day in a row of not feeling well. He was tired, his legs were heavy, so he went to bed early. The next morning he woke up about 7 a.m. and he texted work, said he wasn't coming in. Within the hour, he had a heart attack. And by noon, he had a stent put in his heart. He also has 2 daughters. I want you to take away one thing from this presentation, is that early detection of serious health events can save yours and your loved one's life. Chad is lucky, he's doing okay. He's also a physician. So what I'm here to talk about, and what Guardian Alpha is here to solve, is that most people don't realize the speed in which their health can change. So that's where we come in. So we're leveraging smartwatches like Garmin and Apple, and we pair it with your loved one's medical history. And by doing that, we then create a personalized baseline of vital signs data. Our AI and algorithms recognize early signs of biometric changes that may be a sign of an early health escalation. And when that happens, we then notify the user. But not only the user, we also notify their circle of care. Their circle of care is their family, their caregivers, and their physicians. And when that notification happens, we tell them what may be going on, and we give them recommendations of what to do. So early detection can avoid unnecessary lifelong impairments or death. And remember that your vital signs are vital, and that speed matters. So my co-founder, Dr. Srani, and I, we've dedicated our lives to helping people improve their health, but from different skill sets. So Dr. Srani is an ER physician, and on a weekly basis, he unfortunately sees unnecessary tragedy of patients who just didn't understand how serious a health condition that they were having. Myself, I have almost 30 years in the healthcare space from a healthcare tech and business perspective. I have 11 patents in healthcare, and I've designed, built, and deployed health systems around the world. Our personal network is pretty powerful as well. At Guardian Alpha, we have a mission to prevent 1 million health escalations annually around the world. It's also personal. We both have aging parents that live a long ways away with multiple health issues. So we're a SaaS mobile application that's compatible with most smartwatches. Our B2C model is $19 a month, and we've surveyed over 500 people. And in that survey, 355 people not only said they wanted to purchase the application, but they also gave us their contact information and asked us to follow up with them once our app is available. Our B2B approach is our Guardian Clinical Surveillance Platform. It integrates with current reimbursable healthcare programs such as remote patient monitoring. We're currently in talks with an RPM vendor about integrating Guardian Alpha into their platform. So we also have the ability for our data and our insights to be monetized in research for academic institutions. So Guardian Alpha is about prevention, survivorship, hope, and love. To accelerate and grow quickly, we are working with creating like-minded channel partners with like-minded organizations, such as the American Heart Association and the National Cancer Society. To date, we've identified over 60 like-minded organizations. We've also built our platform so it can integrate into existing wellness apps, and that'll allow us to scale even quicker. We've established a relationship with Garmin here in Kansas City and are part of their API program, and that also allows us to give discounts to our customers for their Guardian watches. So we're scheduled to release in Q2, which will only be about 5 months after we've incorporated. And to date, we've mostly bootstrapped with just a little external funding. We're going to revisit capital raise after launch. So I want to remind you of the story of my friend Chad at the beginning, and in the speed in which one's health can change. So let's make sure that everyone we know in the future doesn't have a moment like that. Thank you.
A great presentation, and you know, I'm a storyteller, so the story of Chad, beginning and ending, I think should hit all of us. We all can relate to that. The question I think that'll come up a lot for me, and I'll ask this to any business about what they do, is what makes you different? And this all looks great. It feels like a million gadgets, devices that we're being hit with every single day from our Apple Watch and on that are supposed to save our lives and do all of this. What makes you different from the competition?
Yeah, so two kind of answers to that. So one, there's kind of two levels of products. One that has to be prescribed from a physician. Those are very exclusive and very expensive. Those are FDA regulated. We are not. We can sell directly to the consumer. So one, the availability. But coming from inside of the health tech industry and healthcare industry, we have that clinical level of acuity and preciseness. So a lot of the none of the other consumer applications or watches take into the medical history, which is key. If you have a history of cardiac disease, or you're going through cancer or a renal or pulmonary, all those, you are then at a higher risk, and then we're able to tune the algorithms to the changes when that happens. The second part of that answer is it's passive. So a traditional remote patient monitoring protocol, so if a patient is sick, they go home, they usually have a scale, a blood pressure cuff, an O2 monitor. That all takes time and effort. And just frankly, people have a hard time being compliant with that. The only thing you need to do is wear your watch and keep it charged. So it's passive and it's continuous.
Thank you.
From a reimbursement perspective, are you going to maybe go down that route at all from like a...
Yeah, so I just briefly mentioned that. So talking with remote patient monitoring, the way it works is one of the devices in the bundle needs to be FDA approved. And so with us talking with this vendor, we're able to bundle that, and then we become part of that reimbursable bundle.
What are the liability implications of being not FDA approved, but doing things like early detection if you get it wrong?
Yeah, so to repeat the question is, what are the liability issues? So we've spent a lot of time on that, and really what we're stating is that we are not directing care, and that is where the line is in the sand. So there's 3 levels of medical devices. We don't meet any of those. And so once you go through that audit and realize you are less than that medical, then long as you have a statement to say you are not directing care, then that limits your liability.
I guess that answers my question. I was thinking about preventability, just or preventative care. I guess since you guys don't do that, I guess that doesn't really matter.
Yeah, so kind of a statement around preventive care. It depends on what how far preventive do you want to go. So obviously, if you exercise and eat great, then that's the most preventative. By us being able to detect such as an infection, maybe a day or two before it presents itself in an extreme manner, that is early detection. We call it is kind of the early part of preventative.
Thank you.
Are your algorithms based off of anything proprietary? How hard would it be for Apple to build the same things and then just ask people about their health history when they use the app?
Yeah, so they are proprietary, and it comes from both myself and my co-founders' experience of just meshing the technology and the clinical side. We get the question a lot of Garmin or Apple or Fitbit trying to replicate this, and really they don't have. Apple is really in the device selling space and not in the healthcare space. I've met with Apple, I've been to their campus, and they don't want to go too far. They just want to sell devices in the healthcare space. So they're supportive of applications like this.
was going to say, you said going live in second quarter 2025 here. So is that like a pilot you guys are starting, or is that?
I mean, initially, actually about an hour before we got here was our initial kind of internal release. We hope to, in the next 3 weeks, start to release it to some testing folks. And then in Q2, we do hope to start rolling it out broad.
Thank you.
All right, thank you.
If you had one shot